Wow, where do you start with a case like this? Teeth are forward, small teeth, dark teeth. Do we just pull them out and start from scratch? Definitely not. This is how we got from there to here. And I'm going to walk you through the entire process from my thought process to the end goal, and you'll see all the preparations. So the goal in a smile like this is to balance the entire smile and make it fit into the teeth, fit into the smile, not having one tooth shorter, one tooth completely sticking out, edges here, yellow here, hypomineralization there, right? So we're looking at bonding on this front tooth that continuously gets chipped and broken. This lateral right here is actually in a really good position. And so when I design my smile, I like to pick maybe one tooth, maybe a couple teeth, and I build the smile to that. And I tell my ceramist, this is the focal point of the smile. Now let's build the rest of the smile to it. So obviously here's what we're looking at, what we're seeing. This tooth is coming out really far forward. This one is set back. This one is sticking out. This one is also in a pretty good shape. And so when I have these teeth that are forward, backward, what I like to do in my initial preparation is to create a uniformity. But before we jump into that with my design team, what I do here is I start designing the smile in a mock-up with wax. It can be done digitally, but this is a way that I'm able to visualize before I get started. Why you see some areas that are white and some areas that are yellow is the yellow is additive and the white is either the current tooth structure or the tooth structure that needed to be reduced. So when I immediately look at this, I know what needs to be reduced and where potentially I'm doing additive. So this allows me to already know when I'm in there prepping the teeth, where I'm going with the smile. This is my first pass through with the preparation. You can see I did some gingival recontouring to balance the smile. I also created my first pass through with uniformity of the front tooth to the side teeth. This is how I'm able to predict the thickness and final outcome of the porcelain work. So you can see I evened out the edges, I brought the line angles in, and I peaked the gums in certain areas. Here, what we're seeing is this tooth is sticking out. This is in a good position. This tooth, again, is sticking out even further here, drops in here, sticks out here. And what we're seeing back here is decay. So what I'm going to do, as I've said before, is I use a veneer inlay preparation that removes the decay and allows for the veneer to be incorporated so it's one uniform piece of porcelain. The next thing that we're going to look at is the actual preparation. So now I've completed the preparation. If we take that and we look at the arch form, obviously this tooth is back. So what I do on a tooth that's back is I prep it from the lingual so that I add more porcelain. And otherwise, this inlay preparation right here, you can see the porcelain will fill in all of that area. And this is finally the porcelain veneers on the teeth. And so we can see the arch form here is perfect. We can see, even though this tooth was set back, we need a little bit more porcelain there, but everywhere else, it's basically uniform thickness. So if we're looking at this type of a case, I'm going to show you again, this tooth is darker. This one is a little lighter. These are very crowded, chipped, and worn down, and so is this. And so it's really critical to analyze the color once you've prepared the tooth, but also please take a look. Like, yes, I had to reshape the teeth, but by no means do they look like little toothpicks, which in a lot of situations in a case like this, even the bottom that was so crowded, look at that, right? There's far from toothpicks. We've saved so much of the tooth structure, yet we got to a goal and an outcome that is healthy and long lasting. Why I'm showing you these two photos is this color of the front tooth is different than that color. And so the communication to my ceramist, this being a 3M3 versus this tooth being a 2M2, it's critically important for him to know how he's going to layer the porcelain so that at the end goal, it all looks the same. So the arch form of this one on the bottom here, obviously this one's sticking out, this one's sticking out, and this one's a little back. So when I prepare to make them even arch form, I prep some from the back and some from the front. And even though we're going to have porcelain veneers looking like they're all even, really beautiful, nice translucency from the back for my patient, he's still going to know that this tooth right here, as he rubs his tongue along the back of his teeth, are misaligned. The porcelain veneers is just an illusion game, right? We're creating the illusion that he's got this perfect, beautiful smile. So here's the temporaries. This is our working finals. So we work all of the kinks out, the lengths, the shapes, the edges. All right, we do as we always do. We try in half of the permanent veneers to the temps, and we're able to see that the roundness of this edge right there, the transition of these two teeth, notice this step between these teeth as we get into the back. We want to make sure that this is always shorter, about 1 millimeter to 0.5 millimeter and change in there. And so as we're here, we're rounding that corner, all right, and we're able to, again, see that step, what I like to call a step between the lateral and the central. So this is always us matching, making sure that there's no guessing games, that we nailed it. And this is probably one of the hardest things to do in this whole process. Cementing porcelain to teeth, we do that all the time. Shaving teeth with a burr, we do that all the time. Predictability in outcome, that's probably one of the hardest things. Here's the porcelain veneers. This is after everything's been delivered. This is actually I think this photo is a 3-month follow-up. Look how beautiful the tissue is looking already. Everything is stippled. It's such a nice little border. All of these little blood vessels around here integrating nicely with the porcelain itself. All of the papilla is finally filled in. It just looks like a real natural tooth coming out of his tissue. This is the final outcome over here. Look at the side profile, right, of the teeth following the architecture of his lip. I mean, that's where we started. There's such an irregularity in the smile. Everything is like a roller coaster. And then we finish it off like this. It's a very challenging case, but if you approach it in a systematic approach and understand where you're going with the end goal, it doesn't have to be that much shaving. It doesn't have to be that scary. And in reality, I feel like we have turned back time for him. He is confident. He looks great. He owns a soccer team out in Greece. He went out there, won a championship. He's back, smiling, living his life. So it's really nice to be able to treat people, make them love their smile, and see their whole family as our patients.